Hi, I'm Amrisha Sandhu, and I would like to present this presentation about magic mushrooms and its medicinal use. The euphoria induced from eating magic mushrooms have earned them a cult-like following. Psilocybin is a naturally occurring substance found in magic mushrooms, and it's classified as a psychedelic. Psychedelics can affect all the senses and alter a person's thinking, sense of time, and emotions. Magic mushrooms activate serotonin receptors in the prefrontal cortex, which regulate thinking, thought analysis, and plays a key role in mood, arousal, and perception. Psilocybin mimics serotonin, a neurotransmitter related to feelings of happiness and love. Psilocybin has been shown by MRI scans to create a state of hyperconnectivity between brain networks, which increases neurogenesis and drastically alter thought pathways. Research believes that it's the combination of these healing effects that makes psilocybin an effective tool for combating depression and addiction, for which research shows support. The therapeutic benefits of psilocybin have been the focus of the most recent research. For mood and anxiety disorders, trials have suggested that psilocybin may decrease symptoms of depression and anxiety and cancer-related psychiatric distress following even just one single dose. Patients with treatment-resistant depression showed reductions in depression and anxiety. Studies have also shown profound success rates of tobacco cessation. Psilocybin has many medicinal effects to help treat depression, anxiety, and addiction. Psychiatric mushrooms have been used for thousands of years and have a long history of both medicinal and ceremonial use among indigenous cultures in many parts of the world. In ancient shamanism, psilocybin was only taken for initiation rites or for healing ceremonies to address severe medical or psychological problems. The proven effects of psychedelic mushrooms in treating psychological conditions have recently served to scientifically validate what shamanistic and societies have known for countless generations. By the late 1950s, Albert Hofmann, the chemist who accidentally discovered LSD, became the first scientist to identify, isolate, and artificially synthesize the active ingredient of psilocybin. Recognizing the medicinal value of the mushrooms, Hofmann packed psilocybin into pills and marketed them as a drug called psilocybin. Aside from basic research studies, this generated exciting preliminary evidence that psilocybin showed promise for treating anxiety, depression, and addiction. Anxiety disorders can be debilitating and severely interfere with daily life. Psilocybin shows efficacy in treating excessive anxiety and behavioral disturbances. Studies have shown that anxiety is significantly decreased as measured by the State Trait Anxiety Inventory post-treatment. While studies have been small, they've shown that even low doses of psilocybin have helped with severe anxiety with little to no side effects. Psilocybin can help ease the depression that accompanies a diagnosis, and it allows patients to, and allowing patients to use it is medicinally is truly merciful. Additionally, research demonstrates how effective magic mushrooms can be in treating depression. In some cases, even just one single dose can be enough to alleviate the symptoms permanently. The reason for the change seems to be that psilocybin's effects on mood and emotions. Users report feelings of joy, connectedness to others, and to the world around them. The emotional effects are also characterized by intense feelings of uncontrollable laughter, forgiveness, silliness, playfulness, exuberance, ego dissolution, altruism, and gratitude. These transcendent experiences appear to linger. These expansive, sometimes life-changing experiences help users feel profoundly connected and alive. The intensification of emotions appear to enhance the ability for introspection. Although magic mushrooms are widely outlawed and commonly dismissed as dangerous party drugs, a growing body of research casts them in a much less nefarious light. Studies show psilocybin is not physically addictive and it's rarely toxic. Not only are they safer than not only are they safer than many people believe, but they also show amazing potential to help with a variety of mental health problems. Feelings of euphoria and love are commonly reported benefits of psilocybin. The shift in perception and emotions positively affects patients. Research shows that psilocybin can cause a paradigm shift and relieve patients' fear of dying. Studies show it can increase the quality of life by decreasing hopelessness and depression. It also can induce states of consciousness that have lasting personal meaning and spiritual significance. These findings strongly suggest that psilocybin therapy is a promising means of improving the emotional, psychological, and spiritual well-being of patients that suffer with depression and anxiety. These discoveries continue to build on the growing evidence supporting the benefits of psilocybin on mental health. Magic mushrooms are increasingly being seen as a psychiatric wonder drug because of its profound antidepressive effects. Although this research is still in its infancy, there's enough compelling research to determine that psilocybin has medicinal value for treating depression and anxiety.